Ein Tunnel, Licht,
A tunnel, light, warmth, safety. What is that? Experts speak of NDE, of a near-death experience. Berlin Heart Center. It's often a matter of life or death here. In 2008, Carsten Harms comes to the clinic to have his heart examined and operated on. No big deal. Everything begins unspectacularly. It was a routine procedure, a cardiac catheterization. This is a well-known intervention. It is performed everywhere and is really nothing special. Also, the insertion of an implant is a tried and tested approach that has been practiced for almost 10 years, as far as I know. The family man and economist is currently making a career for himself. Carsten Harms is one of the youngest community mayors in Brandenburg, but a congenital heart defect has been bothering him for some time. He has even suffered a heart attack. Now surgery at the Berlin Heart Center is supposed to fix it. What Harms doesn't even slightly suspect is that he will have an intense near-death experience during the operation. I was then wheeled into the operating room and transferred to the surgical table. At first, everything proceeds normally, but then unexpectedly acute atrial fibrillation occurs. As evidenced by the medical documents, the routine suddenly turns into a struggle to keep a proper heartbeat, which is completely out of rhythm. At first, doctors tried to stimulate the heart with medication, unsuccessfully. Carsten Harms lies in the operating room under general anesthesia. I was asleep at first, had no sensations, no consciousness, nothing at all. Then, all of a sudden, I felt myself slowly sitting up. Then it went on that I found myself in front of this clock, right in front of the clock. I was on the same level with it and could look at it directly. I still remember that clock exactly as it is today. In fact, there is a clock in the operating room of the Berlin Heart Center. Finally, the doctors succeed in restoring the heart to normal with an electric shock. During this time, Carsten Harms has his near-death experience. I then floated through a cloud cover. First it was dark and then suddenly very, very bright. I was in a sea of clouds. At the top right I saw a light, a very bright light, a very warm light. It was a beautiful place of peace, of love, of warmth. I felt tremendously safe. It was such a moving and pleasant atmosphere that I could experience there. It was simply overwhelming. When he wakes up from the anesthesia, Carsten Harms is irritated. He can't make sense of it at all until he later learns about the events of his surgery. When the intervention was over, the doctors came to my bedside. My wife was also present. They told me that the implant had been properly placed, that the congenital heart defect had been corrected, and that everything was now fine. And rather casually, they mentioned that I had ventricular fibrillation and that they had to resuscitate me. To this day, Carsten Harms is impressed by his near-death experience. It fundamentally changed his life. We ask at the Heart Center, what exactly happened to Carsten Harms during the surgery? Professor 𝗵𝗃𝗏𝗏 was in charge of the surgery at the time. You can think of a power surge as being similar to the reset function on a machine. You apply an electric shock and thus set the entire heart rhythm to zero so that it can restart again. To our surprise, the heart specialist describes that near-death experiences, such as that of Carsten Harms, are not uncommon at the Berlin Heart Center. This is something we do not consider unusual, since we naturally have patients who are critically ill, who lie in intensive care for a long time, who repeatedly struggle with death and eventually survive. And these patients, of course, report something like this on a regular basis. Near-death experiences, or NDEs, are a worldwide phenomenon. It can happen to any of us at any time. What I experienced there, what I felt there, what I took with me emotionally from there, moved me deeply. It has left deep traces inside me, which inspire me every day of my life.